people. Arbonne has also become a passion of mine, and I never knew it would be, so this is pretty exciting. Just to recap on what Carrie said about Whole Foods, I was there on a Sunday just heading into my office to do some paperwork. My hair's in a ponytail, I have no makeup on, I'm running in to get something and run out, and these ladies happen to stop me because I'm talking with somebody else about nutrition. And I thought, well, maybe they know something about skincare, because I had so many patients of mine asking, what do I put on my face and what do I put on my skin? You're helping me with my musculoskeletal system, you're helping me with what I put in my body, but what do I put on the outside? And unfortunately, I didn't have an answer for them back then, and I was very embarrassed that I didn't. And it was something that I just didn't think about. You know, you slather it on every single day, a little bit's better, more is even more better, and you just keep doing that. So I started searching and looking at different companies with the help of my assistant, Jamie Wolf, who's also my massage therapist. And we started looking at different companies and trying to figure out, you know, what's good, what's bad, and just couldn't really come up with anything that I thought I would put my name behind until I ran into Carrie and Catherine. And right away, Carrie gave me a product manual of all the ingredients in the products. And not too many people want to know all that, but I did, because I wanted to make sure that this was going to be a healthy choice for my patients. I didn't want them coming back to me and saying, why would you recommend something that is so horrible? So I saw the product manual, I went through it with a fine-tooth comb, and I was really, really impressed. And one of the things that impressed me was their weight loss line. And when she first explained Arbonne to me, and she told me there was a nutrition end and a weight loss end, I just kind of divided myself and said, no, I won't be doing that part of it, because I do my own stuff in the office. But as soon as I started looking at the ingredients, and I looked at the shakes that they offer, there was one thing that stuck out in my mind, and there's a herb in there called Gymnema in the weight loss shakes. This herb is so important in like curbing sugar cravings and sweet cravings, and long-term use, the research is showing 18 months of use of Gymnema actually changes insulin resistance. And I'm dealing with a lot of insulin resistance in my office, so I was like, good one for Arbonne. Like they knew their stuff, they knew what they needed to put in these shakes. So I started looking at that a little bit more. But anyway, so back to the manual, I went through it, called Carrie, or she probably called me actually, and said, what do you think? And so then I went to Gail's house, and Gail invited, where are you, Gail? Here. There you go. Gail invited me into her home on a Sunday, and I was impressed with that she would open her home on a weekend just to let me ask some questions and to see what this was all about. Again, I was just looking for the use of the products for myself and for my patients, not looking for it as a business. And then it just became a no-brainer just to do it as a business as well, because the compensation plan is incredible. It's the philosophy of the business rides right along with what my philosophy is in my practice. So this is kind of how I got involved with Arbonne. And I'll tell you a couple stories in a little bit of some success stories with using Arbonne in the practice. Something about my practice, I've been in practice since 2003 with my husband. We focus mostly on musculoskeletal disorders. We treat a lot of athletes, probably 80% athletes, some young children and some very elderly people, and then some teenagers in between there as well. I started dealing with a lot of ADHD or ADD, colicky babies, and now I'm into a lot of hormone testing and balancing. And this has been the most exciting part of my practice because confusion reigns in female hormone land, and that's just where we are. And it just seems that my practice has just changed so much that this is where the focus has become. So with talking about hormones and balancing out these hormones, it just falls right into what you're putting on your skin, what you're doing at home, what water you're drinking, because all of these foreign substances that we're inhaling, ingesting, putting on our skin, they're called xenohormones, and when they come into the body recognizes them as estrogen, and they actually sit on receptor sites just like estrogen would. And most people are estrogen dominant, including men. I'm doing a lot of testing on men as well. And I'm seeing all this estrogen dominance. Well, where's all the estrogen coming from? It's coming from our drinking water. It's coming from our lotions and all the chemicals and the phthalates in our lotions that we're putting on our skin, and it gets absorbed in the body, goes through the liver, or sometimes doesn't go through the liver, and comes out basically like a phytoestrogen. That estrogen is making our hormones go really, really wacky and making us feel like we want to kill our husbands, throw our kids out the window, and crawl under a blanket. So all of this doesn't have to be happening if you can balance things out. So how do you start? You start changing what you put on your skin. You start changing your shampoo. You start changing your supplements that you're taking. So you're not taking something from Jewel or Dominic's that is made so cheaply, and your body has no idea how to recognize it, and your body will never assimilate it, to changing and using something that actually is a whole food or herbal based. And that's one thing that Arbonne does have. They have nutrition that does have herbs in there, and some whole foods. So that part also got me very excited. Other things that you can change, I don't want you to think that Arbonne is the only thing that you need to do to change your life. You have to start thinking about the outgassing of the furniture that you buy, or the plastic curtain you put in your shower, and all the chemicals that come off your plastic curtain when the hot water hits it, and you're in this nice little gas chamber. So you change that so you're not getting all these extra toxins into your body. But Arbonne is one of those places that you can start. And what I tell my patients, you're going to start small. Just start small. Do one thing at a time. Change out your shampoo. Have some tea tree oil in your shampoo. That sounds great. Why not? So you don't have to use Head and Shoulders and all those chemicals to combat your dandruff. Use Arbonne's tea tree oil shampoo. So there you go. There's another thing that you can do. Back to my practice, we do a soft tissue technique called Graston that very few practitioners in Illinois do. And we get people better usually within 8 to 15 visits, from anything from low back pain, shoulder pain, knee pain, arthritis, all these types of things. And the nice thing is that people are in and out of the office and they're not there for months and months and months. We do some kinesio taping, which is a taping technique to get inflammation out of the joint or in the tissue. We do massage therapy, and I wanted Jamie just to say a few words about the massage therapy and her experience with Arbonne at this point too. This is Jamie Wolf. She's a massage therapist and my office manager.
Hello. I have the pleasure of working with Dr. Michelle every day, or almost every day.
Almost every day.
And I was introduced to Arbonne about a year ago, right after Dr. Michelle was introduced to it. And came to a meeting, started to just use a little bit of the face products, the RE9 line, and I really, really liked it. So my next question was, how do I incorporate this into my practice? So I actually started looking into it, and as Dr. Michelle was also looking into it, we found some products that I could actually, from Arbonne, put into the lotions that I use when I'm massaging somebody. And I get excellent feedback. It helps them unwind, it helps them relax. If I'm doing a sports massage, which is one of the things that I specialize in, I just use different products to incorporate depending on what other people need. And I've been really successful with it so far. So basically what I do is specialize in sports massage.